Hello everyone, this is Dr. Khan, Executive Plastic Surgery. I have a wonderful patient of mine from Florida. She actually accompanied one of my patients I operated on a couple days ago. She is right now currently in North Carolina, and so she comes to me as a surprise guest, I should say, because I was not expecting you, and as soon as I open the door, there you are, and I see our patient that I did the Facebook Live on a couple days ago. So it's a pleasure to see you. It's very rare that I get to see my patients because a good number of them are from out of state. So you had your surgery in September of 2022, and so this is the many months later that I haven't had a chance to see you. And as soon as I entered the room, you literally got started with the many benefits of having had the explant in the manner that you did. Now let me ask you a question as we get started. When did you first hear about breast implant illness?
I first heard about breast implant illness, I guess, about 6 months before I reached out to you. So it was not until maybe 2021, and I was still very sick. I had cancer in 2018, lymphoma.
Lymphoma.
Yes.
What was that cancer, that lymphoma?
It was a Hodgkin's classic lymphoma,
Mm-hmm.
and I went through treatment for 6 months, and that was in early 2018. And then I anticipated feeling really good afterwards because I was completely cured, and in fact that didn't happen. And so after I didn't bounce back from that, I just attribute it to the chemo. But then a year goes by and I'm feeling a lot of symptoms.
But prior to the lymphoma, and I just want to go ahead and emphasize to the audience, this is not the BIA-ALCL, which is not the BIA breast not the breast implant associated anaplastic large cell lymphoma. There are other types of lymphomas, and this is the non-breast implant related one.
Yeah.
So you essentially, there's a very good treatment for it with the chemotherapy.
It's a very good
cure. Now, prior to you getting the lymphoma, you were not feeling well?
I was not feeling well. I haven't felt well in years, and I got my implants done in 2007. And after having my children, I was in my 40s. Well, I was 38.
Now, what's interesting is in 2007, they had just reintroduced the implants into the market, saying that these are the gummy bear, these are the safer, better, more cohesive.
Yes.
You can drive an F-150 over them, and these were reintroduced into the market as that. And you had just gotten them because you had heard about them being safe.
Yeah, I was going to get the saline because I never even knew that they were reintroduced into the market. And when I went to my plastic surgeon, he actually persuaded me to go to the silicone, and I was nervous about it. But he was saying, oh no, they're fine, they're safe. And I guess, I just went with his recommendation. He also, I very vividly remember talking me up a size, and I was like, no, I think they're too big. But he's like, oh no, because you have to fill them out and this and that. And I was like, okay. So I was never really happy with them either because I just didn't feel natural. And I mean, I guess everyone said he did a great job, but I just didn't feel like they were for me.
Sure, I want to go ahead and emphasize, I talked to a lot of ladies. Many ladies I've heard this from, they have said that they never liked them from day one that they got them.
Yeah.
And this is true for most of the implants, that initially there might be a grace period where they might look good, feel good, but then inevitably over time, they're not meant to be in the body forever, as clearly stated by the manufacturers and by the FDA. And over a period of time, the longer you have them, the higher the chance for problems, complications. So you had these implants in 2007, and so when you came and saw me in 2022, you have had them for 15 years now. Now you had just, going back to what your story is, you had gotten the treatment for the lymphoma, you were cured from that lymphoma, which is not breast implant associated, and then what was going through your mind?
I was thinking, oh, I'm gonna feel great, I'm gonna, get back to my normal life, but not, but within reason, because even before the breast implant illness, I want to point out, after I had the breast implants in 2007, it was a couple years later that I started getting depressed. I'd never been depressed. I got depressed and was on depression medication and just really not a happy not as happy as I knew I could be. But then after I got cured from the cancer, I was, really anticipating feeling better physically, and it didn't happen. And I was still very lethargic. I was 35 pounds heavier than I'm now. I was at 156, I think, when I came here. Now I'm like 125.
Wow.
I was in bed. I was a lot of itching in my breast. I was, like I said, I was lethargic. I was just pain in my body, and I fell once. I was just so disoriented. Just my head, I never felt like real clear-headed, and I fell off of a cliff, and I told you, a 10-foot cliff, and that's in 2020, and ruptured one of my implants, but I didn't know it because it was COVID going on.
Got it, okay. What were the other symptoms that you were going through of the breast implant illness?
Just pain in my muscles and my joints. Bad skin. I had really bad skin, dark circles under my eyes.
Mm-hmm.
I would get headaches and just like fog, like not clear-headed. I was just irritable, depressed, anxious. I was on depression medicine, anxiety medicine. I was in bed a lot. I was just didn't feel confident in my body. I didn't like the way they looked, and just really not in good health.
Sure. Now, Flimmer, if you can hand me that chart. So what I'm going to do now is I'm just going to, every patient that comes, and again, we're not going to share anything personal, no names, but this is the symptom questionnaire list that all patients undergo through, and just looking at it, you will see you had almost, the chronic fatigue, the brain fog, you had the muscle aches, pain, weakness, hair loss, you had the night sweats, you had the swollen tendon lymph nodes, tingling numbness in the arms and legs, burning around the chest and breast, muscle twitching, vertigo, you had the low-grade fevers, nail changes, swelling around the eyes, premature aging, changes in vision, you had digestive issues, shortness of breath, chest pain, feeling like you're dying, recurring infections that you had mentioned, throat clearing difficulty, swallowing, amongst other, including depression and mood swings, emotional instability. Now, how did you find me?
I prayed a lot, and I put in breast implant illness because, one of my yoga instructors I saw a Facebook thing come through from years past. She actually had implants, and I didn't even know it, and she was doing a Facebook saying she got them out, and she was talking about breast implant illness, and I was like, as soon as I heard it and heard her symptoms, I just intuitively knew. And so I got onto Facebook or to the internet, and I researched, and you were the first person that popped up. And I was thrilled, and I just knew in my heart after hearing your testimonial, and hearing you, but then you encouraged me to at least get an opinion from a doctor in Florida, which I did because I was so far away from you. And I did, I made an appointment with a plastic surgeon who did agree with he acknowledged breast implant illness. But when I went to see him, I was not happy. He immediately said that he would not take the capsules out, which I told him based on what your recommendations, that I had to have those out. And he also said that I absolutely had to have a lift, and he would do like this popsicle lift at the time of the surgery. And I said, nope, I'm going to Dr. Shaher.
Yeah. Now, one thing is very important. Had you, and this is just in retrospect, hindsight, gone to him and you had both ruptured implants.
Yes.
And so you would have had spillage of the silicone into your chest inevitably, because if the en bloc or the 100% total capsulotomy was not going to be done, or if any of that silicone had not been contained. And this would then have continued to linger on, because no matter how hard someone tries, it's very similar to slime. It would continue to be in the chest, it would continue to hurt, and it would continue to cause that silicone toxicity that would linger on literally for a long time, because you cannot wash this off, you cannot have drains and let this drain out. Now, another thing I mentioned is, and this is all anecdotal, because remember, there is no scientific test, there is no imaging, there is no lab workup that will state that you have breast implant illness. This is a diagnosis of exclusion. Now, it is also important to note that you go to someone who believes in breast implant illness. Number one, that's 50%. And the other 50% of the challenge is that the surgeon is able to carry through and carry out that operation where the entire capsule is removed along with the implant as one system definitively. Because if any of that capsule is left behind, and especially in your case, if the silicone spilled into the chest, it would continue to be a problem.
Yes.
Now, so you go ahead and finally you do your research, and remember, this is one of those topics where once you get involved initially and you start reading, it may be very overwhelming. But if you continue to follow and listen to these type of discussions, and more importantly, not only listen to the physician, to the clinician, to the plastic surgeon, but listen to the patients, you will see that you look at that questionnaire and you will be able to connect the dots.
Mm-hmm.
Look, my doctors are saying, my endocrinologist, the allergy immunologist, the rheumatologist, that you don't have all of these symptoms and it's all in your head. Now you will be able to pinpoint and highlight that these symptoms truly mimic what is breast implant illness. So you basically make the trip from Florida, and I remember you just like I saw you just a year and a half ago. Now, a question for you. So you came here, you were well bred. I remember just like every patient, you're nervous but also excited because you know what you're signing up for.
Yeah.
You've done extensive homework. Anyone who comes to see me has that insight to have had learned from my website and from the other patients. How was your whole surgical experience?
It was beyond great. I mean, I was lucky enough to have a friend come with me, and we got an Airbnb and have 2 dogs, so we stayed for a week, 5 days. And the surgery, I mean, it was a lot. I was in there for 5.5 hours, but we had ruptured, and we didn't know the other one was ruptured, and that stuff was on my chest. But so I was prepared for it though. But the staff, you and the staff were amazing. And I came out and I listened. I followed your advice, and the recovery went as exactly like I anticipated.
Thank you very much for saying that. I want to go ahead and highlight to the listeners, it makes my job easy that, and yours certainly, those patients that start moving their arms, remember this is very hard.
Yeah.
Because some people like to talk with and move their hands, or some people are very active on a day-to-day basis. You have to learn how to, quote, train yourself to be slow motion. You have to have the bra and the binder on, and you have to be in that state of recovery mentally. So you tell yourself it's very transient, it's not forever, and it's usually 6-8 weeks, and where you're giving your body a chance. I remember I looked at the numbers with you. We didn't go into the surgery till like 10:29 was start time, and basically 3:56 p.m. is when we finished. And again, the whole goal of the surgery was, we knew the ruptured implant on the right side and the surprise on the left side, and it was all contained, everything came out. You did not have that unnecessary lift. This is, again, the con procedure. What I did to you is what I did to your friend who you came with. Number one, no need for the unnecessary drains, despite what is an extensive inflammation, because all of that tissue was removed. Number two, no need for the unnecessary lift, because remember, the tissue, the chest, the breast tissue has taken a big beating. It's inflamed. You do not want to be doing anything big and fancy, i.e. like operating. Remember, I love to operate. I would love to do a lift on everyone, but this lift is not required, and as you will attest to the fact shortly. So no need for drains, no need for an unnecessary lift. I send the cultures off to microbiology for aerobic, anaerobic, and fungal. I take the capsule and send it to pathology to make sure it's not the CD30 analysis confirmed, not the BIA-ALCL, which is the breast implant associated anaplastic large cell lymphoma, breast implant associated squamous cell cancer, breast cancer, and certainly anything abnormal and irregular. Number four, I give the videos and the high definition pictures to the patient showing complete removal. This is where you have the twilight anesthesia, where you are not paralyzed, and then all the patients essentially get the same surgery regardless of the size of the implant or the age of the patient or the comorbidity, such that the patient recovers completely and definitively. Now, next question for you is, and again, very important point, that sometimes the patients start moving their arms and they're now in pain, and now when they're in pain, they require more pain meds. So this is very important to be very compliant, and thank you very much for listening to me. Now, post-operatively, How and what was your recovery like?
My recovery post-op was surprisingly phenomenal. I mean, I felt, I did not use it, I might have used the pain meds 3 days at the most, and then I weaned myself off. I mean, it was an extensive surgery. And then I was just taking Tylenol and just taking aspirin. Like I said, I followed it for 2 months, but then as I started to, get out of the binder, I took it easy, and I would say within 6 months, I was back to doing yoga. I mean, I was up. My friends call me like the Energizer Bunny, because I'm constantly on the go, go, go for the past 2 years, or a year and a half since coming out of the surgery. I love the results. I don't even need a lift. I'm very happy. I lost, like I said, I was 156, I'm down to 123, just by being active and eating healthy. I'm off of all antidepressants and all benzos, anti-anxiety medicine. I have not had any necessity for that.
And this is what you were telling me yesterday, your personality has changed.
My personality has come back to I feel like I am my old self. I mean, I could just cry being like how grateful I am for the surgery and for you. I mean, literally gave my life back. And my people around me have seen it. My kids are now grown, they're 18 and 21, but my friends, my family, they're like, wow. And my friend that's here with me, she came, she saw my change, and she's like, wow, I need to get this done. And
right. No, I appreciate, you are raising awareness by sitting here,
yes,
by sharing your journey. You already have influenced someone. We did the Facebook Live a couple days ago, both ruptured saline implants. Look, you have both ruptured silicone implants, she had both ruptured saline implants from 1977, 47-year-old set of ruptured implants from almost a decade or decade and a half ago. And no one should have to live with ruptured implants, the silicone, the toxicity. Now, one thing I want to mention here is, and again, with HIPAA compliance, I'm going to go ahead and share basically your pathology report.
Yeah.
So the right breast implant capsule excision, and I'm going to quote, and I sent this to you, shows fat necrosis, which is dead fat, and foreign body giant cell reaction. This is your body trying to find out what is this foreign body. And with associated non-polarizable material consistent with silicone mastitis. Silicone mastitis, mast means breast tissue, and itis means inflammation. And so this is the inflammation, the hurt at your breast by being in the proximity of the implant, and then the dead fat because of that chronic inflammation. On the left breast implant capsule, essentially the same quote, fat necrosis and foreign body giant cell reaction with associated non-polarizable material consistent with silicone mastitis. And then I also removed what is a right breast mass, and it says, quote, fat necrosis, foreign body giant cell reaction, and non-polarizable material consistent with silicone mastitis. And again, this is basically precisely the reason. And I send this over to the pathology, rule out BIA, ALCL, CD30 analysis. Now this is, now you have the peace of mind for the rest of your life. You don't have to worry about any residual capsules. How many times do I have to deal with, interact with patients who have had implants removed, and now they have history of ruptured silicone because the previous surgeon did not remove the whole silicone, or basically the silicone sedimented down towards the lower part of the chest area, and now I have to remove that. So patients with silicone granulomas, there are other patients that have come to me with residual capsules and they have not bounced back completely. There are patients that have had lifts unnecessarily done, and now they have pins and needles around their nipple areola, or in a situation like yours, for example, if the lift was done, the patients had skin necrosis because too much surgery was done on a day when the emphasis was not on the explant and the tissue was left behind, and now the wound dehisced open because remember, it was irritated, inflamed tissue. This is not the tissue to be suturing around and manipulating and moving around, doing a lift, when the entire emphasis should be on the explant. And remember, on that day, let's say that patient who required the lift, you do not want to be on the OR table for another couple of hours because that will only add to chances of higher infection, DVT, which is clots in the legs, amongst other problems that arise the longer one is on the operating room table. Now, what do you have to say to someone who says to you, this is all in your mind?
I would
all in
say
your
that
head?
is absolutely impossible and it's ludicrous. I have had periods of very good health in my life, and I have a high tolerance because I've had cancer. I know what it feels like to feel healthy and unhealthy, and it was not in my head. I've gone through years of being very healthy and active. This was a real thing, and I would not be sitting here, and I would not be encouraging my best friends and my family members to do something. I'm a very realistic person. This was absolutely caused from the breast implants, and I would say that it was even before the ruptures, because I was feeling a lot of the negative effects before that. They just got exacerbated when the ruptures, obviously.
Sure, no, absolutely. So very clearly, we have the pathology report.
Yeah.
We have you, and we
Yes.
have literally hundreds and thousands of women who have come forth and attested to verbatim exactly what you have said.
Yeah.
We have a history of implants being banned in 1992 for the same reason that you mentioned. We have the inflammation. These are not your safer, better gummy bear implants. They do rupture, they do disintegrate.
Mm-hmm.
We have seen this many times where the implant ruptures and causes the same hurt and havoc that these implants from before 1992 caused. So we are essentially
Yes.
reliving history in itself and the hurt that the patients are going through. And these are not my words.
Yeah.
Implants are not safe devices. Just yesterday, you were supposed to have done this interview at 3 o'clock, and I had just walked out of the operating room. I had to see another patient, and so we had to delay this interview because, to my surprise, that patient who had the implant from just 8 years ago, from 2016, had the silent rupture, meaning the patient did not know, just like on your left side it was a silent rupture, that patient had a rupture. And so there are many patients just going about their daily lives, living with ruptured implants, not knowing that they had ruptured implants. And this is why the manufacturers themselves say, get an MRI at year 3, and then every 2 years they're onward. If you listen to the newer FDA recommendations, they recommend doing what is a more practical ultrasound, and I find that is better than nothing, but deficient still, because the MRI still, what I would say, is the gold standard to screen. No one should wait for a rupture to remove, and I'm not trying to make this as a scare for the patients. It will rupture sooner or later. In your case, your friend's case, for example, they probably ruptured 3 decades later, let's say, because she had them for 47 years, but they were supposed to be the safer, better saline implants. Now we will see what her recovery is going to be like. She is 73 years of age with bilateral saline ruptured implants.
Mm-hmm.
You had the silicone ruptures. Now what is happening, and I find as an explant specialist, and my practice is exclusively devoted to removal of saline and silicone implants and residual capsules. Those many patients, exactly in your category, who in 2007, 8, 9, 10, and thereafter went to the plastic surgeons because the general consensus is the implants are safe. Now they're coming in the masses and coming in, and we're finding one rupture after another because they're not getting the surveillance. They're feeling the hurt, or they feel that they need to get the other symptoms of breast implant illness addressed, because we, like I said earlier, do not have a lab diagnosis or imaging diagnosis, but we have that questionnaire where one lady who is truly not ill, not sick, and now she has the many symptoms that she has checked off, and now all the fingers are pointing towards breast implant illness because all the other doctors have said no. The point here is, one needs to be alert and aware that implants are not safe devices. They're not meant to be in the body forever. The longer one has them, the higher the chances of problems. And one must seek a surgeon out who, number one, believes in breast implant illness completely, sincerely, definitively, to the point where he or she is not putting in implants, because that's the ultimate proof. And number two, the surgeon should be able to carry out and do the operation where the whole capsule and implant is removed without any of the silicone spilling into the chest. Because if it does, you can imagine sitting here maybe improving 70%. or 30% or 50%. You want to look back at your surgery day and be excited that your surgeon removed the whole thing completely, definitively, sincerely, such that none of the capsule was left behind, and if indeed the implant was ruptured, none of it spilled into the chest, because that is something, once spilled, very hard to clear definitively and completely, no matter how much the washout is done. Do you want to say anything to anyone? Now, let me ask you this question, because one thing that you told me yourself when I walked in that 35-minute discussion that I had, I would say you had a chance for your insurance to reimburse you.
Yes, I do want to point that out. When I was so committed to this. I had not been working because I went through the cancer, and I was on Medicaid actually. But I was so committed to having this done that I actually saved the money and borrowed the money from friends to have the surgery, and because that's how committed I was, and thank goodness. But after that, I kept notes, meticulous notes of how I was feeling prior, and the MRI that I had to have because of the mass.
Yes.
I got that, and they approved that, and then
because you had the trauma.
Because I had the trauma, yes, and they approved that. And then I got all the documentation from your office and your notes and all the notes, and I put it all together, and I didn't even use a computer. I hand wrote the letter to my insurance company, which was a Medicaid funded insurance, and I pretty much told them that this is medically necessary, this is not elective, these were not safe. I was very sick, and had I not have gotten them out, it would have cost them more money because I would have been hospitalized more and more, and running all these tests that showed me nothing. And I got everything except for the $75 deductible that I would have paid for surgery.
Wow.
Reimbursed, and excluding the I didn't even file for the anesthesia because I didn't have the right codes. But I got every single penny reimbursed,
that is very
minus
impressive.
the 75.
So I like what you said. Now for me, when anyone comes to me, I write down breast implant illness is the diagnosis, even though there is no true ICD-10 code. Now remember, I am not depending on ICD-10 code to tell me what to write or not. I write down what I see, breast implant illness or silicone toxicity, just like your pathology report. I write down essential surgery. In the time of COVID, when the hospitals were shut down, at night in the morning, I was doing explants because the hospital understood I was not doing elective or semi-elective surgery. There were orthopedic colleagues who could not do ACL repairs, for example, or rotator cuffs, but I was able to go in because I told the hospital, and the hospital and the operating room committee knew better that this is essential surgery. So I read that down, non-cosmetic surgery, medical necessity, and in your case, the right breast implant rupture, because now the insurance companies tend to look at it and say if you have a grade 3 or a grade 4 capsular contracture. In your case, going into the surgery, you had right breast implant rupture and you had right and left grade 4 capsular contracture. So that was something, and again, obviously what you wrote down. The other thing I want to emphasize is you were very meticulous.
Yes.
You took notes, so I tell my patients to go ahead and get notes from your endocrinologist, allergy immunologist, rheumatologist, anything, cardiologist, primary care doctor, whoever, such that you can make your case and make your case file thick and big. Remember, if you think about it, that day you had the most non-cosmetic surgery.
Yeah.
Because I didn't do anything like fat grafting or lift. I essentially removed the toxins, the badness. And every insurance should have that professionalism, that integrity. Those doctors that work for the insurances who continue to consistently and persistently decline approvals, they should be ashamed of the fact that this is not cosmetic surgery. This is an aftermath of not giving the patients true informed consent. Implants are not safe devices, as you can see in your case and the many others. Almost all the patients that I've discussed and talked to post-op, they have said two things. Number one, they wish they had never gotten implants, and number two, they wish they had gotten them removed sooner. And this is where no one should have to undergo this surgery and then later on have to deal with problems. I have a lady from Georgia. She had breast cancer, right DCIS, which is the ductal carcinoma in situ. She had 1,140 cc implant on the right, 1,000 cc implant saline on the left. epidermal reconstruction. She came to me just 2 months ago, and her surgery was done in August of 2023. She had fat necrosis, grade 4 contraction, amongst the many others. Now, there are many patients who are happy and good for them, but they need to all realize their time will come. Hopefully never, because there might be other problems that might overtake, but it will be only a matter of time, because the fact of the matter remains that the breast implants are not lifetime devices. Just like the FDA states and the manufacturer state, the longer one has them, the longer one has implants, the higher the chance of complications that do arise, like rupture. So being meticulous and taking the notes and getting the doctor's notes, and I like what you mentioned, that the cost of going and getting further workups is going to be more than the cost of getting the Explant when done right.
That's right. And when I did speak with my insurance company, because I would call, and I made them known ahead of time that I was going to appeal any decline or in service.
Yeah.
And I got the name of the ombudsman for the insurance company ahead of time. So I let them know that I'm not going away, this is happening.
See that again, I want you to emphasize what is, and I know
An
what you're
ombudsman
saying.
is someone that is for the patient, and it looks at your patient rights, and so you get rights with your insurance company, just like when you go to the hospital, you have rights. And if you have a dispute with your insurance company, and you may need somebody to mediate that with the insurance company, so, because you don't wanna just talk to the person records, they say, well, I don't know what I'm talking, they keep transferring you wanna say no.
So you knew how to work the system.
Yes, I knew how to, and my
you-
rights,
Yes,
yes.
and your
patient
rights, and everyone has rights.
Yes,
That-
everyone
when
has
you-
rights,
when
you
you
go
fly
out of
over-
town.
Yeah.
And they were like, well, why don't you go into a doctor in town? I said, because this is the doctor I wanna go to, and I told them the doctor in town has actually more money and wants to do what these things that are necessary for me. And this is why I'm choosing the doctor of my choice.
And I like how you were assertive, professional.
Yes.
And you were very direct, and you knew that you were only going to reappeal, and this is very important. So the last patient, for example, they declined. So the patient asked me, would you do a peer-to-peer? So believe it or not, when I did the peer-to-peer, an ENT doctor came on, and I asked him what type of specialty, and he said, I'm a head and neck surgeon. And I said, when is the last time you even touched an implant, let alone hear about it? And he said, before you start with your story. That's exactly what he used, the word story. I said, we're dealing with a patient and her life. And he said, let me tell you, we are never going to approve this. We have never, and this is just our policy. Now go ahead. And he was very direct. And again, what a shame. The patient, another patient before, when I had to do a peer-to-peer review, the insurance company hooked me up with basically a pediatrician who was going to approve. And again, he wanted me to send him paperwork on breast implant illness. And when I told him I need to record this conversation just like they were recording, he had declined that. And again, the point here is the system is all not in favor of the patients. The system is all meant for the insurance companies and all aligned such that the beneficiary is always the insurance company, unfortunately. Even the hospital systems, unfortunately, you ask any nurse, doctor, anyone who works at the hospital, especially involved with administration or insurance, you will hear it's all about making more money for the insurance companies and less for the hospital, less for the doctors. And certainly nowadays there's a big push and a drive, let the patient pay the bill. The number one reason for bankruptcy in the United States are medical bills, and unfortunately the burden is being passed down to the patient. Anything else you can think of that you want to mention and alert and raise awareness?
I think we covered it all. I just want to, re-emphasize how great I feel. I have no regret whatsoever. This is the best thing I've ever done for myself, after making that huge mistake of getting them in. But we didn't know that we thought they were safe, and for whatever reason, we did it, I did it, and don't beat yourself up. Just, take care of your health and get them out.
Sure.
Because your life is gonna improve dramatically.
Yeah. No, I want to go ahead and say, you say this very well. In retrospect, you did your homework, you did the insight where you knew in your heart what you needed to do. And again, I tell every patient that I talk to on the phone, and I tell them, your time with me is not to basically make a decision. You want to get the hard facts. This is the informed consent. Now what's ironic and interesting about your case is, let's say you decided to go to the top hospitals in the country, the best of the best in Europe. All of them inevitably would say, well, it's time for you to remove your 07 implants, and let's go ahead and put in the 2022 version when you got, and this is certainly a very wrong answer, because the system tells you that these are safe. And absolutely, they are not, I use the word safe devices. This is part of the informed consent. If anyone looks at the warnings, one would only make a rational decision not to get something that is very temporary and ultimately not worth it. Remember, the goal I myself as a plastic surgeon took, do no harm. And this is where do only good. You don't want to take chances. Yes, you may have a transient period, and this is what I tell to the breast cancer patients or to the young ladies who are interested, or the ladies who are interested in getting them even in their 60s or 70s, which I've seen happen. It is not worth the risk, not worth the hurt, and we have clear convincing evidence from the history that this is an implant, the saline or silicone, that will only ultimately hurt you, some sooner, some later.
Yes, I agree with that completely. They are no good, get them out, and I wish I would have never gotten them in. It would have saved me years of, sleeplessness, about the fatigue, all of it. And, it's never too late, obviously, but they are not safe.
No, thank you very much
Yes,
again.
thank
I appreciate
you.
you. Thanks to the listeners, appreciate you listening in. Please share, discuss. The most important thing that I say to you is, please talk to the surgeon's previous patients, because this is where you will get good insight for joining other Facebook groups where you get a chance to talk to the other patients and seeing what is the goal and essence of the surgery. And I will end with this. The goal of the surgery is to remove the entire implant and the capsule and all inflamed tissue that's in the periphery of the capsule, and removing it completely, definitively, sincerely off of the rib, which is where it is in majority of the cases, such that the fascia of the pectoralis minor, the intercostal fascia, the periosteum, perichondrium, and then the lower fascia, the inferior aspect of the pectoralis major fascia is removed along with the implant, such none of that silicone spills into its chest, no inflamed tissue is left behind, and the entire focus is to doing the surgery sincerely, thinking that every implant is ruptured till proven otherwise. So thank you very much, everyone, for listening. Please share and discuss. This is Dr. Khan. Thank you.
Thank you so much. I appreciate you. You saved my life.